Good morning, everyone on my timeline. Happy Easter holiday. It's I can hear some echo. Happy Easter holiday. It's a privilege to be here again on a Saturday morning. It's a cold Saturday morning as well to bring to you, as we always do, another webinar. And of course, today we're talking about a very important organ in the body, the liver. So this webinar is still brought to you by Wellness Healthcare Group. I'm Adesutu Afolabi. I'm the boss lady of Wellness Healthcare Group. I'm an emotional wellness coach. I'm also a pharmacist by profession. I I love doing this every month because a lot of lives have been blessed. A lot of testimonies have been sent back to us about how this has made a difference in the way people have been living. Last month we talked about cancer and what we should do, and the doctor actually advised every one of us to put in our best to ensure that we have a healthy lifestyle, especially because some of the causes of cancer is not known, and the fact that for those cancers that can be prevented, or for most of the cancers, if we are able to prevent it, it is easier for if we're able to detect it early, it is easier for people to live longer. Today we're going to be talking about liver disease and what we should know. Wellness Care Group is passionate about improving the general well-being of the people, and this is what we do consistently through seamless access to care through our Wellness HMO platform, and through our pharmacies. Also, we also make sure that people have quality pharmaceutical care, quality pharmaceutical products at their disposal. With wellness, you are sure that you're getting only original medication. Another thing that we've done to also ease the access to care is the launch of our Wellness Plus app, which we did in February, which gives the people power to choose. Now people can buy their HMO plan at will, and they can also go for medical checkup right there on the app and enjoy seamless access to care. Today, where I'm not alone, I'm going to be here with Dr. Babatunde Adigun. He's a consultant physician and gastroenterologist. He's actually in FMC. Is FMC Abeokuta? Not FMC, pardon.
Abeokuta.
Yes, FMC Abeokuta, and he's passionate about this organ called the liver. He has spent so many years ensuring that people are well taken care of, and people understand what the impact of the liver is, and that is what he's going to be sharing with us today. Don't forget to share the link with friends and family. Don't forget to share the link with people in your household, people in your workplace, especially because knowledge is powerful. The more we know, the better we are at the end of the day. He's going to be breaking it down. He's going to be explaining things to us. He's going to be sharing from his wealth of knowledge how people are going to be okay if they take care of their liver. So join me as we start. And also, we want to plead with you to subscribe to our YouTube channel. If you subscribe to our YouTube channel, every of these webinars, you wouldn't even need to we wouldn't even need to send the flyers to you again. You already know that we have something going on. Please subscribe to our YouTube channel and tell friends and family to subscribe. Let's make this work. Thank you very much. So we start. Dr. Adigun, are you ready for us? You're muted. Are you ready?
Yeah. Good morning. Yeah, I am ready. Good morning, everyone. Thank you for having me.
If you are like me and you are watching, there is this part of beef that I like to eat, especially when I go out to eat. I'm always asking them, Joshua, do you have the liver? Is it fried? And you know, and sometimes when some of us want to cook fried rice, if we don't have the liver in the fried rice, it's as if the fried rice is not complete. Liver and shrimp must be there. The color makes the fried rice look so beautiful. So if you are like me that enjoys eating
Yeah.
the liver, I think you should know what the liver does to the body. So Dr. Adigo, why is the liver so important? We're told that it's one of the largest organ in the body, and what does it do for the body?
Yeah, thank you, pharmacist Falabi. Yeah, talking about the liver, it's actually a very beautiful organ, grossly and microscopically. That means even when you look at it, it's pliable. It feels succulent and all, and also it has a wide variety of functions in the body. And aside that, of course, because its functions are vast, uh, it also has a very large regenerative capacity because a lot of things goes through the liver. For example, first of all, the blood vessel that carries blood to the liver is the one that drains uh, almost all the blood from the guts. And that means anything that we eat passes through the liver for a variety of reasons. Drugs, food, toxins goes in through the liver. Um, Nutrients that we eat, they are processed, stored, transferred to the appropriate places by the liver. Carbohydrate, protein, fatty acids. Also drugs, some drugs have to pass through the liver before they can be converted to the active forms. And some are converted to very bad forms, as in forms that can be deleterious to the body. The liver removes them, excretes them into the bile. The liver forms the bile, which is important for the digestion of fat and also for the absorption of some vitamins. And also not forgetting the fact that the liver produces varieties of proteins that has different functions in the body. Like proteins involved in blood clotting, involved in immunity, involved in making water to stay at the right place in the body. Protein called albumin, majorly is exclusively produced in the liver. So we can go on and on about the functions of the liver, and the conclusion of that is the fact that the liver um, has vast amount of functions that it perpetrates in the body. And this is evidence in the fact that when the liver is down, that individual is as good as gone. And also, it's the reason why an individual does not start um, giving symptoms suggestive of liver disease until it is too late. So the liver is an important uh, part of the human machine, if I could use that language. Thank you.
So the liver that we eat and the liver that is in our body actually keeps the body alive. Um,
Yes, it does.
the transportation of nutrients, processing of proteins that helps practically everything that we do in our body, that goes on in our body. And you said it also helps to metabolize drugs and take out sometimes when the drugs are converted to toxins. Some toxins are part of the conversion. It helps us to quickly take it out. So the liver also help to that means it helps to cleanse the body because it removes toxins from whatever we eat. So no matter what goes into our mouth,
Yes, it
most
does.
times the liver process what goes into our mouth, and it helps with transportation of some of the blood that goes into our body. This is amazing.
Mm.
So let's look at
Yeah,
so
it
what
is.
are the causes of diseases, liver diseases? What leads to any liver disease? Because obviously the liver is very important, and while we eat the meals we eat, we're not even sure what it is being converted to or what is going to harm the liver. I know that if somebody has an accident, the liver can actually be the spleen or could be affected. I don't know if the liver too could be affected in the process. But let's ask. Okay, maybe you should share that. I know that the spleen could get affected when someone is beaten up or someone has any abdominal accident. How about the liver? Is it so protected that it doesn't get to touch it just like that?
Well, actually, any organ in the body can be affected by trauma. The brain, the heart can rupture from trauma.
Wow, we're having a network issue at Dr. Babatunde's hand. Oh, I hope he comes up on time. We're still in Nigeria, and this thing happens. Okay, so Dr. Babatunde actually told us about the liver. And he said the liver has a regenerative capacity, meaning that the liver has the capacity to reproduce any lost part of it at any particular point in time.
Diseases generally, usually we classify them into either acute liver injury or a chronic liver injury. An acute liver injury just refers to any occurrence that comes, just is descending on the liver and causes deterioration in its functions. And it ranges from all sorts of causes, like viral causes like we have here, hepatitis B, hepatitis A, hepatitis Z, even hepatitis C. But then also medications are very important here in acute damage to the liver. Medications, herbs taken, even any drug is capable of causing liver disease, though some are more notorious than others. Then also we have systemic infections. A patient with sepsis can come down with some form of liver injury. But like I said the other time, when we talk about liver disease, really, because the liver is an organ that has very, very, very large capacity for regeneration. So usually it tries to regenerate over years, insult upon insult coming upon the liver, and the liver tries to repair itself until it is no more able to do that. And there are a lot of agents that can cause long-term damage to the liver in what we call chronic liver disease.
Okay, so viral, the liver can be affected by viral, as a result of
By
viral,
viruses.
by
Yeah,
virus.
yeah, 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 yeah.
We have hepatitis A, hepatitis B, and hepatitis C. The liver can be affected by some medication. I also know that if anyone decides to take 8 gram of paracetamol, you could have an acute liver injury. So you cannot,
Yes.
um, viewers, you cannot say that the pain is so much, and you take 8 gram will be 16 tablets of paracetamol. You can't
Well,
take it.
uh, actually, as regards medications generally, I was going to come to causes of chronic liver disease. Now, you talked about viral causes. Of course, we have hepatitis A to G, but then there are other viruses that can affect the liver, CMV, EBV, and all sorts of. But usually, those viruses that we tag as hepatitis something, hepatitis A to G, like I said, those are viruses which um, have liver damage as the main thing, main harm that they cause to the body. Doesn't mean they can't cause other things, but then the main manifestation that they have in the body is liver damage. Now, the commonest one that we have in this environment, especially in the developing countries, is hepatitis B. Hepatitis B can cause both acute liver damage that can lead to either a patient dying or a patient subsequently recovering from the illness. Also, we have hepatitis C, which causes more of long-term liver damage. Hepatitis A and E usually causes a self-limiting illness, though they can also cause liver failure and death. Hepatitis Z usually causes just a short-term liver disease like hepatitis A, but in some immunosuppressed people who have their immunity depressed. They can actually have a long-term hepatitis Z infection, but then that is for specialists. Now, also beyond the hepatitis, the hepatotrophic viruses, like we call them, we also have alcohol. Alcohol usually causes long-term liver damage. Then also we have some diseases in the body that causes abnormality of storage of particular nutrients and elements like iron and copper, which also can cause liver disease. Also, there are people who have blockade in one or two other vessels that supply blood or that drain blood from the liver. Those two can cause liver disease, either acute liver disease or long-term liver disease, and even some of them can even cause liver failure, like Wilson disease, which is an abnormality of copper storage. Now, we also have people who lack some enzymes that are responsible for doing one thing or the other in the body, and they can come down with liver disease. But then in this environment, if we talk liver disease, the first one we usually look at is hepatitis B, that is B virus. Then followed by, well, it's debatable, but then generally followed by alcohol, then hepatitis C and virus in some parts of the country, though that is not as common as hepatitis B. And usually those are implicated in people with long-term liver disease. But talking about acute liver disease, and any drug can actually cause liver disease. Even paracetamol in the normal quantity can cause liver failure in some sets of people, though we know that, of course, a particular quantity is the one that is more notorious. But some people can still have liver damage even from the normal dose of paracetamol.
Thank you, Dr. Adigun. So one of the things that you have said specifically is the fact that as from practice, the causes of liver diseases that you've seen a lot is the fact that hepatitis B is number one. Hepatitis B is preventable. Hepatitis B is preventable. I know that since 1990, the government of Nigeria has made it compulsory for every child that was born. Every child that was born since 1990 should have taken their dose of hepatitis B jabs. But for people before then, it's very important that we listen to this and see how we can do the test. And if we're tested negative, we can actually get them vaccinated. The vaccinations is in 3 doses: the first month, the second month, and the 6th month. So it can be prevented. The other curses that you mentioned is alcohol. I don't know. What would you say about this alcohol? It seems to be in high consumption these days. And it's as if the effect is not immediately, so people don't really see it as a big deal. What can you advise viewers on consumption of alcohol? I know that Nigerians always say that something will shall kill someone, but this alcohol and we realize that a lot of people are not even drinking beers that has about 5% alcohol percentage. Now people are doing spirits, and people that are not that cannot pay for that drink ogogoro. That's the local gin, which has a higher percentage of alcohol. Please, what can you advise our young people? Because a lot of people, I know, I was talking to some children. They said they can't wait to be 18 so that they can drink alcohol. What can you help us to? I know that what people can drink is little content, but what would you advise?
Okay, thank you, pharmacist Afolabi. Now, talking about alcohol, though, I think later we'll still talk about the hepatitis B virus because it's very important. But then, I'm glad that you made mention of the quantity of alcohol. Usually, there's something we call significant alcohol use. When we see a patient and we want to evaluate them for possible alcoholic liver disease, we try to evaluate, we try to estimate how much of alcohol they've taken over the years. And usually we say a man that has taken 40 to 80 grams of alcohol per day for 10 years or more is significant. Now, half of that is for women, 20 to 40 grams per day for greater than or equal to 10 years for women. Now, how do we calculate the grams? Like you said, most of the green bottles, the Heinekens, the Stars and all, they are 5%. And most of them are 600 mils. So that's 5 over 100 times 600. That makes them 30 grams. Usually, we say 30 grams is allowed for a male per day, 15 grams for a female per day. Now, the caveat to that statement is the fact that genetics plays a lot in how people respond to the same level of risk factor for any disease, not just liver disease. Now, there are a lot of genetic polymorphism, that is difference in the rate of expression and activity of different types of genes that is involved in alcohol metabolism, that can make one person that has taken half of that significant dose that I mentioned to come down with features of liver disease, and can make someone that has even taken up to that, and you do everything, you do all the tests, and well, and you can't find anything to suggest liver disease. But this is the point we try to make, that not only for liver disease, alcohol has other effects in the body, on the pancreas, also in the GIT, in the GI system, on the heart, and it's also a risk factor for a lot of cancers. So the truth is, for anyone who has not started taking alcohol, it is advisable don't start. If you started, try to reduce it to the barest minimum or stop it, because the way alcoholic liver disease presents is in a spectrum. The first part of the spectrum is fat infiltration of the liver. That means fats gets embedded into the liver, which also is a cause of liver damage. Now, progressing from just fat infiltration, we have what we call alcoholic hepatitis. It means the liver cells start getting damaged by alcohol. And also, because I mentioned the other time that the liver has a very high regenerative capacity, the liver tries to regenerate itself, and in so doing, it's just like if you cut anybody with a blade, all things being equal, the body heals, but it heals with a scar. So if you continue to cut that person, it will get to a point that the ability to heal will not be up to the damage that is happening. And if that persists, that causes fibrosis. Those are scars in the liver. And when it gets to a particular point, it leads to what we call liver cirrhosis. Liver cirrhosis from any cause whatsoever, alcohol, hepatitis B, hepatitis C, or whatever, is a risk factor for liver cancer. So, but then also because liver disease, usually in the early stages, might be as bad as a patient will be asymptomatic. That means there will be nothing at all. Either, well, we say no clinical feature to suggest liver disease. Those are symptoms or signs. Symptoms are what the patient complains of. Signs are what the physician picks. Now, usually in the early stage, a patient has vague symptoms, non-specific, ill-defined. A patient has, and usually when such patients goes to the hospital, they tell them they have malaria today, they have typhoid tomorrow. And usually that is when it starts telling them that, okay, there's a problem. But because people also in the country do not get well evaluated for anything, so usually by the time a physician is able to pick that this patient has what we call peripheral stigmata of chronic liver disease, those are things that when you look at anybody, you see that this person most likely has liver disease. By that time, that liver disease is far gone. And usually there's little or less that you can do, especially in a poor resource setting, like sub-Saharan Africa. Yes.
Like
So yes, like ours. So the best is what I said the other time. If you have not started, don't start. If you have started, reduce it to the barest minimum. I've mentioned what is allowed for males and females. Or if you can stop it completely. If anyone has problem stopping any bad habits, not only alcohol, smoking, hard drug use, or whichever one, there are people that are well trained that one can talk to. Yeah.
Thank you, Dr. Adebu.
Mm.
How about palm wine? Somebody just asked now about palm wine.
Well, I would say it's like saying, okay, and you said we shouldn't take alcohol. What about beers? The content that is the culprit here is alcohol. So whatever has alcohol in it, what you need to first of all find out is, am I exceeding my daily allowance? But then, like I earlier said too, sometimes it's difficult to estimate the alcohol content of these drinks, especially if they are not the regulated ones, like palm wine. Who does it's not as if one will get a keg of palm wine and you go to a chemical lab and tell them, oh yeah, analyze the alcohol content of this palm wine for me before I take. But then the truth is, whatever one does, either alcohol or even food, has to be in moderation and within health limits. Yeah.
Thank you, sir. Okay, can you tell us some of the symptoms we can see? Some symptoms
Okay.
that an individual can notice that will
In people with
prompt
liver
that
disease.
person.
Okay. Now, when we talk about, usually, well, I think the kidneys might be better in this regard, but when we talk about liver disease, sometimes you see people with yellow eyes, and or maybe someone just fell ill and they have yellow eyes. Doesn't mean they have liver disease. No. High bilirubin in the body, in the system at a particular point doesn't confirm liver disease, because there are many things that can cause jaundice. But now, that is why I'm putting emphasis on chronic liver disease. Chronic liver disease is a spectrum from chronic hepatitis. That means you just have features, maybe histological features, that is, you have taken a sample of the liver to see that the liver is being damaged by something, or maybe you run lab tests which are not specific for a particular cause anyway, though a particular pattern can say this is what this is. But let's say a patient has is coming to the hospital and telling you that, okay, I'm ill, and a physician is able to pick that this person has liver disease, like I just said, that liver disease is advanced. Now, if in the early stage, usually when we pick patients, for most of the time, when we pick them in the early stage, it is an incidental finding. That means maybe you are looking for something else. You do not do abdominal ultrasound scan. The radiologist now tells you that the liver is looking somehow or something, or you have high index of suspicion, which is what one should have, and all physicians should actually have, especially people that are not liver specialists. Because when the patient comes with not being well today, just feeling tired and all, that is the time for a doctor or even a patient to say, okay, can I just run a general checkup, please? Just let me run liver function test, kidney function test, let me run a full blood count, not just malaria drug today, ciprofloxacin tomorrow. No, because that's the only way we can actually pick people in the early stages. For the overt symptoms of liver disease, like the ears become fluffy, some people have fullness around their chin, usually associated with alcoholic liver disease. Some people can have reduced hair in their axilla, the hair in the private parts become reversed. Some men can start having enlarged breasts. No, the testicles can become smaller, the abdomen becomes protruded, You see veins on the abdomen, visibly distended veins on the abdomen, people start losing weight, or some people now develop the over symptoms of what we call decompensation. Those are complications of liver disease, like talking irrationally, vomiting blood, kidneys will start malfunctioning, or even liver cancer. As at that time, there's more or less nothing that anybody anywhere in the world can do. In fact, in some cases of liver cancer, because even for liver cancer, even if you say, okay, this is a new liver, transplant it, we even have criteria for what they call it, for liver transplantation. That means even at a point in time, if you have everything available to you, there might still be little or nothing that anybody can do. So the truth is, going about what are the features of the findings that you have in patient with liver disease, those are not things that we see and we are happy, because it usually connotes that liver disease is advanced. And especially in Nigeria, we are now so hampered with a lot of things, either the technical know-how or the availability of machines, or even cost. If a patient has complication of liver disease, now let's say the tummy is swollen, there is water there and all, an average patient that comes to the hospital for admission and for treatment, even if there's something that you can do, it's very expensive, because the drugs that we write for our patients, they are very expensive. For instance, let's talk about albumin. A bottle of albumin can go for as high as 70,000-80,000 naira, and a patient on admission can need sometimes up to 6, up to 10 to get them back up. And it doesn't mean that they will not need that again in the next 1 month, because even the albumin that the body produces has an half-life less than 3 weeks. So the best thing really when we are talking about liver disease is not to talk about what are the things I can see that will make me say I have liver disease. No, you don't want to wait till that time. The point should be towards the major risk factors that we have, how to prevent having them, or even if anybody now has liver disease, to pick them in the early stage and see if something can be done about it.
Thank you, Dr. Adigun. So what you're saying now is it could be so asymptomatic, meaning people can
Yeah.
have liver disease and not even have symptoms. By the
Yes.
time they're having symptoms, it's already a bad case. And
Yes.
this seems to be the major fact for all these
Mm.
diseases. We've had a cardiologist talked about hypertension. We've had an endocrinologist talked about diabetes, and now you are also saying for liver disease, you might not know anything until it is bad, because we're told that the moment you are being diagnosed of diabetes or hypertension, the damage has already started in the body.
Mm.
And that's makes everything scary. Sometimes you're wondering what could be done. So you've
Mm.
also laid emphasis on the fact that there are some things that are major causes of these illnesses. The alcohol and hepatitis B are the major in Nigeria from practice, and what one can do is to see how you can limit your exposure to this. I know that hepatitis B can be prevented. So, people on my timeline, let's look at how we can protect ourselves from hepatitis B infection by getting vaccinated. And for alcohol, we might not be able to tell any adult to stop alcohol, but we can plead with you to reduce your intake. He said that 30 grams per day for a meal is ideal, but the truth about it is you do not know your genetic makeup. You do not know if your body can take this like every other person. So the standard might not work for you. And if you do not know, you do not know. So the best thing is to reduce exposure to these causative agents so that you can be fine. Because the moment we're seeing symptoms, the disease is already in the advanced state. Okay, so
Yeah.
you said that there could be people can do liver transplants. Can a part of the liver be, you said can they like we do skin grafting? Can it be done for liver as well?
Yeah, definitely liver. Liver transplants can be done, yeah, and it's uh, it's even part of the regular treatment and in developed areas of the world. Though in Nigeria, that is not established yet, but there's an association that is on ground now, trying to bring up support and expertise for liver transplantation. And also, you know that for any organ transplantation, there should be legislation backing it up, so as to know how the practice will be regulated. But of course, the liver is is a bilobed organ, though it has some accessory lobes, but then majorly it's a bilobed organ. So usually in patients who need liver
Transplant.
transplant and you find a suitable donor, it's just like taking a lobe of the liver from that person and transplanting it into the recipient. Of course, after doing all the matching investigations and all. Now, for the in the beginning of presentation, I talked about the liver's high regenerative capacity. So the other lobe that is left in the recipient, in the donor, sorry, hypertrophies and starts doing the function of what a whole liver can do. So it's something that, especially for our patients who have end-stage liver disease like liver cirrhosis, and they have a lot of complications. Yeah, that is actually the gold standard of treatment for them. And also for people who have acute liver failure, those are people who have a seemingly normal liver, and an insult just comes on it and just decimates the liver. Like people who have taken a particular type of drug or poison or herbs, or maybe even people who have acute hepatitis B and they have liver failure. Of course, liver transplant is indicated in them. And also people who have liver cancers in the early stage. And usually at this stage, we talk about the number of the tumors that you can find in the liver and also their sizes. So people who have liver cancer in the early stage, of course, they can also have liver transplant done. But then the issue of organ transplants, my opinion about that is that it's usually not even about um, giving the organ. It goes beyond that, because that organ that you are giving, it's a foreign body,
Hmm.
except in yes, except in people who are the monozygotic twins, those are the identical twins who have almost the same genetic makeup. So if you have a foreign body in your system, either it's an organ or it's a bacteria or it's a virus or whatever, the body's immune system, they will they will stand up against it. And for you to suppress it, you have to use some medications. Those medications are very expensive. And apart from being expensive, if you can afford them, uh, the infections and every other thing that the body's immune system is supposed to repel, they also come knocking. But then, of course, it just depends on how prepared the health system is, having a good structure that takes care of all these steps. Finding donor, not just pinning anybody down in the bush and harvesting their liver, and having the expertise to do it, then maintaining the liver graft in the recipient. But then, of course, liver transplants in the nearest future to become a thing uh, in our environment. Yeah.
Thank you, Dr. Adegun. Thank you that we're going to get there. But we need to protect our liver before we get there, because you don't know, even if there is a donor,
Mm,
the body
mm,
might still reject the organ because it's a foreign body. Okay, so I
yeah.
Is it okay for people to take multivitamin that helps the liver every day, even if there is nothing?
Well, there are a lot of multivitamins that are being projected in the market now. I won't want to mention names, but then we have a lot of them that contain phosphatidylcholine and silymarin based ones and the rest. But then the truth is, there is really no evidence, academically that says, okay, this particular vitamin, blah, blah, um, we can prevent liver disease. But of course, we know that in people who have evidence of liver damage, some of these vitamin
Multivitamin.
supplements can help. Yes, multivitamins that has been, formulated towards the ability of the liver to regenerate. They can help. And some are not vitamin based, some are just herb extracts like silymarin, which has been well researched in Egypt, and they're antifibrotic. Also, we have specific vitamins like vitamin D that we prescribe specifically for patients with fatty liver disease. And there are some isolated evidences that, of course, but then not that one will be indulging in a very harmful practice, and you say, okay, I know I'm taking so vitamin, my liver is protected. We don't have any evidence to support that. Yeah.
Oh, thank you very much. So, what you said specifically is the fact that yes, people can take multivitamins, but most of these multivitamins have been channeled towards repair. And you can't be taking unless you can't have an
Mm.
unhealthy lifestyle and think that multivitamin can help you reshape the damage you are being done that you're doing to your liver. And there is no evidence academically to show that when you take these multivitamins it can prevent liver disease, but there are evidences that some of these multivitamins can be taken to help people to help the liver regenerate and repair itself. Thank you very much. So I'm going to ask another question now that somebody just asked. Somebody said that one of the reasons why they eat a lot of cooked liver from animals is because they feel that it helps their own liver. Is there any correlation between eating liver and
Oh,
your own liver?
well,
Please hold on. Please don't forget to share this link with friends and family on this time.
the only thing I can say,
Just
okay, can I respond to that?
yes, sir.
Oh, okay. So, the only answer I can give to that question is that, well, of course, you get a lot of nutrients from eating the liver of an animal, but that it is going to help your own liver. I don't have any evidence to support that one. But of course, the liver is highly nutritious, so it stores a lot of nutrients. So it's just common sense to know that when you eat it, you can also gain a lot of nutrients. But then that eating liver strengthens your own liver. I'm not aware of that.
Okay, so eating liver might not strengthen your own liver, but the liver is nutritious and it's good to eat. Thank you. Okay, how
Nutritious.
about weight?
Yeah.
How does weight
Yeah.
and being overweight and being obese affect the liver?
Well, being overweight generally is a no-no for anybody. It's not just related to the liver, it's related to the heart, to a lot of things. Obesity is a risk factor for most cancers.
Hmm.
Yeah. But then, talking specifically about the liver, we have what we call fatty liver disease. which can be alcoholic and non-alcoholic. One of the risk factors for the non-alcoholic fatty liver disease is obesity. But that doesn't mean that people that have lean physique, people that are not fat, that doesn't mean they don't have
Fatty
uh,
liver disease.
fatty liver. In fact, there's an entity now called lean body fat liver, because we know that, yes, because we know that there is a lot of pathways that leads to one having a fatty liver. But then, of course, if anybody is overweight or one is obese, it is important that you work on your weight, not just for your liver, for a lot of things. But for fatty liver generally, it's very important that anybody who has it knows on time, because gone are the days when we used to think um, fatty liver is benign. Well, benign in the sense that I'm not saying it's cancerous. No, I'm saying telling a patient that, "Oh, don't worry, your liver scan just says that you just have fat there," because now we know that one of the highest causes of end-stage liver disease of unknown cause is fatty liver. So someone who has had fatty liver throughout his or her years, in the late stage, they develop end-stage liver disease, and you start looking for the cause, you can't find it. Those are the causes we call cryptogenic, cryptogenic liver cirrhosis. But then, such people might have had fatty liver that was not well managed. So if you do an ultrasound scan and you see fatty liver, just be like, you just saw fat in my liver. No, get to the hospital and find a liver specialist that can monitor you. Because there are even evidence that such a just as hepatitis B can jump from a normal liver and give liver cancer, fatty liver can also do that. And like I said, in such patients, usually patients who have had fatty liver in the past, they now have cirrhosis, that is fibrosis of the liver. You start looking for the common causes, or maybe you even try to probe deeper and see what might have caused this person's liver disease and you can't find. Then you should probe into previous history of fatty liver. So to answer the question, of course, having extra weight affects a lot of things, the liver inclusive.
Okay, viewers, we started this year with the webinar on our weight, how to maintain a healthy weight, and Dr. Monisola actually told us that if you can preach and hinge, that means you need to lose weight. I've been following it. I've been able to lose 5 kg in the last 4 months. It's slow, but I'm getting there gradually, and that's because she made emphasis on the fact that the weight actually disrupts everything. And that's what we keep hearing from all the people that have come for these webinars. All the specialists actually, in fact, it's as if all the diseases, the weight actually predisposes people to all kinds of diseases. So if you're on this timeline,
Yeah.
she said that just eat a little portion per time. She does not preach abstinence, but she says whatever you are eating, make sure it's small. If you want to eat that bread, eat just 2 slices. If you want to eat that swallow, make sure it's not more than your fist. Yes, she actually said it shouldn't be more than your fist. And we should try to just eat little at a time and make sure that whatever we're eating is nourishing. And I think the liver too is saying that we shouldn't eat, we shouldn't grow there, we shouldn't be carry extra weight again. Your body already has the weight
Yeah.
God has designated for it to carry. And if you have extra weight, that means we are actually stressing the frame that God has created to carry that weight. So whether we like it or not, if you are busy on my timeline, is the time to also shed some weight. So can you please don't forget to share this link with friends and family. It's very important so that they can hear this too. Can you help us with some of the lifestyle practices that can help improve the health of the liver?
Okay.
Apart from alcohol, we already know that alcohol now
Yeah.
reduce it. Then weight,
Yeah. Yeah.
you have to manage. So what are the other lifestyle? Are there meals that help? Are there food items that
Thank you,
help
ma'am.
the health of the liver and all that?
I actually have Yeah, I actually have a slide with me that I was going to project that talks about how to safeguard liver wellness. Just something that is related to the topic of this webinar. And now the first on my list is actually to let people know that not all illness is is malaria and typhoid. We cannot. We have to stop that, especially the use of this test called wider test, because that wider test for a particular type of antibody, which whose production can be can be uh, made possible by a lot of things. And also for wider tests, you need like two different measurements that are like weeks apart, to say is there an increase or decrease in the titer of the antibody that is being measured. So there are actually better ways to diagnose typhoid fever. But then that's not what they are talking about. I'm just saying, usually when people come to you, today they are healed, tomorrow they are healed. Usually it's because there's something that you are yet to figure out. The human body, that's the way God has made it. It gives, well, few people will tell you that, no, you say a patient with liver cancer, they'll tell you, no, doctor, this illness just started 3 weeks ago. But if you probe, almost all my patients, if you probe that, have you been in and out of the hospital in the past few months? They will tell you, yes, I have this fever every now and then, tiredness, and that's actually the body telling you that, see, something is wrong. And these organs, yes, the kidneys, the liver, those are the organs that takes care of a lot of things in the body. So when those things are not being taken care of, the body, is like an engine that is not working maximally. So the body starts telling you. So please, if a patient comes, try and evaluate them. If you see any abnormality in any of the investigations, if you cannot interpret them, get someone who can. Secondly, I said I was going to talk about hepatitis B and hepatitis C. If there's anyone on the timeline, you have relatives, you have friends, the best advice you can give them today is know your hepatitis B and C status. Now, hepatitis C, usually, if people have it, by the time it starts causing the liver-related symptoms, usually it goes through all the stages: chronic hepatitis, liver cirrhosis, that's liver fibrosis, like scarring of liver and liver cancer. But hepatitis B is notorious because hepatitis B can just jump from a normal liver, and boom, the next thing you see is a mass growing in the liver. So, and these are things that this is a condition whereby there are medications for. Well, for hepatitis B, we don't have a cure yet. Though some of these drugs can cause clearance, or even the body itself can clear it by itself, but in a very minute percentage of people. So usually what we do is that we have endpoint of treatment, and the major one is that to prevent end-stage liver disease. But the first point is you knowing that you have it. Not everybody that has hepatitis B infection has hepatitis. They are different things entirely. Hepatitis B infection is the infection. Hepatitis B is the disease. So someone can have chronic hepatitis B virus infection, and another person can have chronic hepatitis B. Those are two different terminologies. But then we find that out in the hospital, and we treat and then we treat as appropriate. Thirdly, is that for people who have what they call it, for people who have negative hepatitis B surface antigen status, they should get whoever has not been vaccinated, get vaccinated, and whoever has been vaccinated before, usually we talk about booster doses. I think every 5 years, though depends on the guidelines. But then we are in Africa with different efficacy of vaccines and all sorts. Ideally, if a patient gets vaccinated for hepatitis B, they should, after 2 to 4 weeks, they should go for the antibody quantification to know if they are immunized. Vaccination is different from immunization. Let's leave let's leave that at that. I've talked about alcohol. Then the next one, I will talk about is eating healthy diets, like reduce your saturated fats. All those fast foods and all. Yeah, reduce them. If you want to eat chicken, peel the skin. Um, Low carbohydrates, a lot of vegetables and fibers. A lot of fruits, and these are all just a regular dietary advice that every one of us knows. So let's just eat well, but then whatever we eat, vegetables, you cannot overemphasize their importance. Now, next in the line is avoid taking spoiled food. Well, that might not be applicable to people who are well to do. But beyond that, there's something we call aflatoxins. Usually, people who have lived in the villages or people who grew up in poor resource homes, they know that when you leave Eba overnight, you see some muco going on top. Those are that's aspergillus flavor that produces aflatoxin, and there's a lot of research that has gone into why for us in Africans, we have a lot of liver cancers. Even when we have the same prevalence of hepatitis B virus infection with some other countries in the world. And we've seen that this aflatoxin increases the virulence of hepatitis B like 10 to 15 times. So they are kind of synergistic in the sense that they join hands together to cause liver damage, and it actually increases. Is one of the things that is being pointed to why we have high incidence of liver cancer in the environment. Though a lot lies with the government here, because it's not just about eating spoiled food. All those rice in bags that we are buying, all those beans we buy in the market, there's a aflatoxin concentration in them, and there's a particular concentration that is supposed to be measured called aflatoxin index for every grainy food food particles being sold. So a lot lies with the government in that sense, but then for us, when we want to, when we want to buy bread, don't buy bread that already has all those muco in them, and if you must eat granite is better, roasted at home, eating fresh and all that can uh, help us in that sense. Now, the next one, I'm almost done. The next one is that even if you cannot do all the investigations for checkup, try and do a yearly abdominal ultrasound scan amongst uh, amongst other investigations, because abdominal ultrasound scan, especially if done by especially a radiologist, can show us a lot. It shows you how the liver looks, especially the organs in the anterior abdominal wall compartment, because we know that there are a lot of people who get treated on time just because they went for maybe abdominal scan for something else, or maybe routine, and they just and the radiologist just see that they have fatty liver, or the liver is looking somehow, and so they have to refer them for proper evaluation. Next is that we should try and be vigilant with our health. Once you know that, of course, with age, we know that the body will not be as it used to be. But you are noticing that you get febrile today, you get febrile tomorrow, you're having pain here, your body is just not feeling right. Go to the doctor on time and get a proper checkup. Usually, people will say, if you want to have tests done, that is expensive. But trust me, the amount that individual is going to spend on the long run will be times millions of what they should have spent in safeguarding their
Help.
health. Then the next is that yes. Then the next is that let's avoid indiscriminate drug and herbal concussion use. People just take a lot of uh, a lot of medications, over-the-counter drugs, and agbo. A lot of bitters are flowing in the market now. People just because what you are doing, yes, because what they are actually doing is to be loading the liver with a lot of toxins. Now, some people's liver is still standing on two legs, so even if you push them, they will stagger and stand back. But for some people, the liver is already limping. So just a little push, and that is all. So I think lastly, about a specific food substance that one can take, there has been a lot of advocacy recently for coffee, especially the caffeinated one, not the decaffeinated one, because the substance that is of importance here is caffeine. Caffeine has been shown to help a lot in liver health, yes. Especially in people who do not have it contraindicated, because we know that the cardiologists, they do not usually like their patients taking caffeine because it can cause some erratic change in blood pressure. It can increase the blood pressure. Also, some patients who have reflux disease, caffeine can exacerbate it. But generally speaking, caffeine is very good for liver health, especially in people who have non-alcoholic fatty liver disease, and also people who are already having scars in their liver. Caffeine has been found to be antifibrogenic. That is more or less anti-scar. Helps in liver health, helps blood to flow very well in the liver, makes the liver pliable, and also a cup of caffeine daily can be good for liver health. Thank you.
Thank you very much. Thank you for this extensive advice. So I'll just do a recap and we end this meeting. Um,
All right.
Dr. Adego said, don't assume that all illness is malaria and typhoid. And I think that a lot of us just go over the counter. Sometimes you are just tired. Sometimes all you need to do is to slow down. But a lot of us just go and take anti-malaria, take paracetamol, take all kinds of things just because we're not feeling fine. While all we needed to do is to just eat and take some time off work and rest for some 2 days. Don't assume that all illnesses is malaria and typhoid. He said that if you have to advise anyone today, advise them to know their hepatitis B and hepatitis C status. And it's very important because when you know that if you even test negative for the test, could get vaccinated. You could get vaccinated. It's a 3-dose vaccination, and it's advising every one of us that if you don't do anything today, just get to know your status and see how you can take care of yourself from there. He has already told us to reduce our intake of alcohol, and if you have not been taking alcohol, don't feel that nature is cheating you. You can just make up your mind not to take it at all. It's not good for your liver. Yes, he talked about healthy diets. We can't overemphasize that. Everybody has told us about healthy diets. Eat a lot of vegetable, high fiber meals, reduce junk meals, reduce junk meals, eat a lot of fruits and vegetable. He advised that we should not eat spoiled food. I know that sometimes you made that meal and you did not remember to take the rest into the fridge. I know sometimes people just want to pick the bad part out and warm the meals. He has explained to us to please not take spoiled food. Mothers, please don't take spoiled food. Don't tell the children to manage that spoiled food. Sometimes people give their maids spoiled food. Please, you're not punishing that person right now. You are killing that person's liver. Please, let's not, don't even, once the food is spoiled, just tell yourself God will provide another one. You know that bread. I know people that eat, they just take the molds from a bar and remove it and still eat it with
Yeah.
hot vegetable, and he said that the thing will not matter. He's telling us that we should avoid spoiled food by all means. And I think that we need to just, you go to a restaurant, you taste the meal is not tasting well. don't manage it. Don't say that there is no an hungry man does not have a choice. You have a choice, because that meal that you want to fill your tummy with can actually damage your liver. Thank you very much. You said that people should try to do medical checkup, and if you cannot afford to do all the checkup, you can as well, just do abdominal scan and see what the internal organs looks like, the sizes and all that, and see what it looks like. He also said that we should be vigilant with our health. If you are experiencing tiredness, you are not, sometimes people say it's old age. When my mom was very ill, she didn't tell us she was very ill until I said that she wasn't looking fine. She wasn't looking fine. Then she's dead now. But when I asked her why she didn't talk, she said she felt it was old age. Old age does not mean sickness. Old age does not mean you should not be fine. If you're not feeling fine and you realize that you've been off and on, and you're not enjoying your body, it's the time to run to the hospital as well and seek medical advice. He also told us to avoid indiscriminate use of drugs. That is drug abuse. Some people go to their friend's house and they see the medication their friends are taking and they take it. Some people, because someone has told you how they were feeling at a particular time and the medication or how they were feeling, and because you felt your symptoms is similar to that person, you're asking the person what drugs should you take. There's so many bitter, so many drugs, so many things that affect in fact, every drug is a potential poison. And that's why you should be careful when taking drugs. You can't just take drugs for drugs sake. I used to work, I did my internship in general hospital. And once the government supplies medication, a lot of people just come to the hospital. And then we're trying to do education, we're trying to educate the people. And it was so funny that the only reason why they come to the hospital is because they want to come and collect drugs, even when they are fine. And so when they are talking to the doctor, they are telling the doctor about symptoms that never exist, just because they want to take medication. Please avoid the use of avoid indiscriminate use of drugs. Avoid, the Google is even very helpful now. You can go on Google and check you can check what is in a drug, the advantages, the benefits to your body, and all that. So somebody is saying these herbs is good, just check it. Especially the local herbs that we make, that we don't even know the composition, and we don't know the rate of toxins that are in those medications or in those herbs. So it's advising us to not just use anything. It's good you speak with your doctor. It's good you make up your mind that you have to protect your liver. So your liver wellness starts with you telling yourself that no matter what happens, you're going to protect your liver. Thank you very much. Thank you, Dr. Adekunle, for coming. We appreciate you. Thank you for being very elaborate in your education. And once again, thank
Thank
you
you.
to our listeners as well. Thank you for coming on this
Yeah, it's my
line.
pleasure.
Thank you for supporting wellness. We want you to still subscribe to our YouTube channel. Share the link with friends and family. We need to protect our liver. The liver is one of the biggest organs in the body, and it does so much work. It does so much work that you can't afford not to protect your liver. You can't afford not to treat your liver well, because eventually your liver is gonna be you. Thank you very much. Until next month, we're going to be talking about our hearts again. We're going to be talking about our heart, because is the month that we talk about the heart wellness again next month. Please don't forget to like our page. Don't forget to like wellness_care pages. Don't forget to follow us on our social media pages. Don't forget to subscribe to this YouTube channel. And don't forget to share this link with friends and family. It's very important. Everybody needs to be protected. Everybody needs to enjoy a state of wellness, which is the absence of illness. Thank you very much, Dr. Adigo. And thank you for the wellness team. Thank you
Yeah,
for
it's my pleasure.
coming again. See you next month. Bye bye.